Class 4. How breastfeeding works. It's important for you to know a little about the basics of breastfeeding and how magnificently your body and your baby work together to produce milk. For millions of years, mothers have given birth and babies have breastfed. Babies are born to breastfeed, and your body is designed to produce milk. It sounds simple, and to a degree it is. Knowing the basic principles of milk production will help you not only get started, but continue to produce milk for your baby as long as you choose to nurse. Throughout pregnancy, your body is not only growing your new baby, it's getting prepared to make milk to keep that baby growing after you deliver. The hormones estrogen and progesterone are produced by the placenta and encourage glandular tissue in your breast to grow and develop. You may notice as pregnancy progresses, your breasts become tender and your bra size may change. About halfway through the pregnancy, your breasts begin producing colostrum, the early milk. Because of high levels of estrogen and progesterone being produced by the placenta, milk production is on hold until after birth. Some women notice they may leak a bit during the second half of pregnancy. Don't worry, it's perfectly normal. You may have already begun to notice some changes in your breasts since becoming pregnant. The area around your nipple, the areola, darkens, and little bumps on the areola, Montgomery glands, enlarge and may become noticeable. Your body puts extra layers of keratin on the nipple during pregnancy, so there's no need to prepare or toughen the nipples beforehand. Nature's got it covered. Even though you can't see them, there are approximately 9 tiny holes in the nipple through which the milk exits the breast into the baby's mouth. You see, your body knows exactly what to do to get your breasts ready for breastfeeding. No special preparation needed. Congratulations! Your hard work in delivery is over. Your sweet baby is born and placed in your arms or skin to skin on your chest. The first few hours after birth are an important time for you and your baby. Many studies show that mothers and babies should be together, skin to skin, naked against mother's bare skin immediately after birth. The baby is comforted, his temperature is more stable, his heart rate, breathing rate, and blood sugar stabilize. Immediately after the baby is born and the placenta is delivered, hormone levels fall dramatically and your body is triggered to begin milk production. Early milk, or colostrum, is present in the breast and is available for baby to ingest when she first breastfeeds. The delivery of the placenta causes the progesterone hormone level to drop, which allows the hormone prolactin to be released from the brain and into the bloodstream. The combination of prolactin and progesterone triggers milk production to begin in the breasts. When the baby begins to nurse, oxytocin, another hormone, is released from the brain and the milk is ejected into the ducts and through the nipple openings into the baby's mouth. After about 48 to 72 hours, with breastfeeding 8 to 12 times in 24 hours, the milk production increases in volume. With frequent breastfeeding and removal of available milk from the breast, production of milk continues and is programmed to make milk according to baby's needs. Breastfeeding is the most natural way to feed a baby. Babies are born with reflexes that help them find the breast and begin nursing. But for mother and baby, breastfeeding is a learned art. In the past, little girls grew up watching experienced mothers putting babies to breast. Today, many women have never seen anyone breastfeed before being handed their own first baby. Without assistance, learning how to position and latch the baby can seem difficult. Mothers also need help interpreting feeding cues, in addition to being able to tell whether their baby is feeding well. It may seem unfair that mothers have to learn these new skills during a time when they are tired and still recovering from childbirth. The first few weeks can be tough, but with support, mothers can enjoy the special intimacy and vital health benefits provided by breastfeeding. Milk is a complex liquid that's the only ideal food for babies for at least the first 6 months of life. The amount produced and the composition of milk is not determined by the mother's diet. Each mother's milk is custom made for baby. The amount of milk produced depends on the amount of milk removed from the breast. The more often the baby breastfeeds, the more milk is being removed, and the more milk is then produced. If a baby is growing normally, don't watch the clock. Respond to your baby's cues for the frequency of breastfeeds and whether the baby requires one or both breasts for a meal. 73% of moms stop breastfeeding because of a perceived breast milk insufficiency, meaning they don't believe their child is getting enough milk at each feed. If you're concerned, seek advice from your healthcare provider. Ask for someone to observe a feeding, to look for proper latch, suck, and swallow. This will help them evaluate the baby's milk intake. For additional reassurance, ask your healthcare provider if they have a baby weigh scale that weighs the baby before and then immediately after a breastfeed. Your milk is all your baby needs for about the first 6 months of life. Your baby doesn't need any supplemental formula unless it's medically necessary and is ordered by your baby's healthcare provider. Your body is perfectly suited to meet the needs of your new baby. Baby's stomach is very small immediately after birth, about the size of a cherry, and can only comfortably hold about a teaspoon or so at each feeding. That's exactly the amount of colostrum your body produces in the first couple of days after birth. Colostrum is like concentrated milk, lots of specialized nutrients in a small volume. Colostrum is high in protein, low in fat, and is loaded with antibodies and other components which protect baby from infections and disease. At baby's first feeding, colostrum coats or paints the intestinal mucosa and helps to seal it so that disease-causing bacteria cannot pass through the intestinal wall. Baby's stomach grows a little bigger each day, and at 1 week is about the size of an apricot. As baby's stomach grows, your milk production increases, so you can continue to meet your baby's food needs. As you become more comfortable in your new role as a mother, and as breastfeeding continues, your milk supply will continue to grow to meet your baby's needs. Milk intake increases quickly during the first few weeks of life. The amount produced stays about the same between 1 and 6 months, the point when baby becomes a more efficient breastfeeder and your breasts are more efficient at milk making. An important thing to remember is that milk removal is the key to making more milk. The amount of milk that is removed from the breasts by breastfeeding or milk expression determines the amount of milk your breasts will make. It's the principle of supply and demand. More frequent feedings, more milk removed, the more milk you will make. Skipping feedings, restricting time breastfeeding, giving supplemental bottles, or rigid scheduling of feedings will lead to a decreased milk supply. It's important to get breastfeeding off to a strong start. As you get more comfortable with breastfeeding, it definitely becomes easier, and soon you'll feel like an expert. In our next class, we'll talk about what to expect after birth and discuss ways to get your breastfeeding off to the best possible start.